could you tell or help our audience understand what is arthritis and then what is osteoarthritis and how osteoarthritis is different from other forms of arthritis like lupus, rheumatoid arthritis, gout, based on your experience, anything relevant to clinical scenarios or even patient findings?
So, one of the first things if a patient comes to see a rheumatologist, we try to decipher, do you have what we consider inflammatory arthritis or non inflammatory arthritis? So, much like that boundary between prediabetes and overt diabetes, right? That line can be really fuzzy sometimes, but we look for signs of inflammation within the joint itself. That's called synovitis. And that typically happens from your immune system causing inflammation signals that target the joint. So your immune system can actually attack parts of the joint. So either the cartilage or ultimately the bone if it continues long enough, or even the tendons. And so we look for signs that there's inflammation driving this process. So that can either be your immune system, like rheumatoid arthritis, or it can be something obnoxious like a urate crystal, uric acid that triggers gout, or calcium that triggers pseudo gout. Or psoriatic arthritis is actually tendon, but it can involve the joints as well. So it can be both. So when you asked, like, is it always joint pain? Stiffness can be the feeling that your joints are painful, but it might be around the joint, the area. So it can be both. So those things cause inflammation that we can block with medication. So just like how insulin lowers your blood sugar, right, to help control your diabetes, we use what we consider disease modifying agents or DMARDs or biologics, which are typically like injections, to block those inflammation signals so that your body stops essentially eating away at your joint spaces. So that's autoimmunity. That's what we specialize in rheumatology.